Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, the legislature has returned. We have State Senator Rob Teplitz. We're going to get into some important issues before the legislature with him. We've invited the House Majority Leader to be on this program, Mike Terzai, a Democrat, a Republican. We'll get both sides. And then later in this program, it's very important, in the wake of the Jerry Sandusky sexual scandal, child abuse scandal, there's lots of activity percolating about what to do to protect our kids. We'll be back after these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, well, welcome back to the program. State Senator Rob Teplitz is sitting across from me. He's a Democrat. He represents the 15th District in South Central Pennsylvania, Senate District. I'm going to be tough on him. He's an F&M alum, so I have to be tough on him. Senator, welcome to the program.
Thanks for having me.
All right, look, one of the things that we keep hearing about that I know, I want to spend a little bit of time before we get to some of the big issues about something that I know is near and dear to your heart, and that's the Government Reform Caucus, which you and a Republican have been working on together in the House. Most people like their own lawmaker. They actually think you work hard, you know, there's no, but when it comes, you get into the Capitol, somehow these changes that folks have identified over the years don't seem to occur. And I know it's tough for lawmakers to, you know, you're fighting sort of the establishment, but what is it that you think you would like to see occur in the state legislature that would make it better and still higher levels of confidence? Go ahead.
Yeah, as you said, Representative Brian Cutler from Lancaster County, House Republican, and I are the chairs of this new Government Reform Caucus that we started. And we have about 30 colleagues, House and Senate, Republicans and Democrats. We meet monthly to talk about ways to increase transparency, openness, accountability, fiscal responsibility in state government. And we've been working on trying to figure out where the consensus is on issues to push as a caucus. And I think we're getting there and trying in the end to make government work better in terms of the process so that we can get substantive results on issues like transportation and healthcare and the others.
We're going to talk about in a minute. Yeah, I mean, it seems to me that, you know, we have a very weak campaign finance law. We don't have much with ethics. Lobbying reform, it's still possible for lobbyists to take you guys, men and women, out, do big gifts, and as long as you report them. And that's sort of been the tough nut to crack, so to speak, despite the fact that there's periodically interest in it, and some lawmakers end up running afoul of certain problems with those laws. And I mean, that seems to be a tougher area to delve into for some reason.
Yeah, those are precisely the issues that we've been talking about in our caucus. We also talk a lot about the need for redistricting reform, you know, after the drama of the last year. Cutting the size of the General Assembly is something that many of us agree on. And what we're trying to do is find the right balance between advocating for policies that are meaningful, but yet can also achieve the votes that we need to pass them into law and get certain legislators to act against their own self-interest to pass them into law. And that's been the balance that we're trying to find.
Okay, let's sort of review here. I mean, it seems to this observer, and maybe I'm wrong, that over in the Senate, you pass a transportation and infrastructure mass transit bill, 45-5, bipartisan. The budget goes over. 6 Democrats sided with the budget. You've got Medicaid expansion, which you passed overwhelmingly. Now, you had some caveats there, but basically they could be worked out. So you seem to be, and I know I'm going to get you into trouble here, you seem to be more bipartisan. You go over in the House and you got the House, you know, it doesn't, can you work through that? That's the big, and the voters want it. I mean, I get asked this, I'm sure you do, can you break this impasse and do something about some of these big issues that you're talking about?
Yeah, I think you're right. I think the voters want to see the two parties working together. And on two very big issues in the spring, that's what the Senate was able to do on transportation and on Medicaid expansion. Both issues got hung up in the House. We're hoping that transportation can get through this fall. Governor Corbett is trying to find another way on Medicaid expansion to achieve the same result. It's not a perfect plan, but at least we're having the right conversation now, and may end up somewhere close. It may be a compromise. It's not ideal, but transportation is where things are really at a standstill right now.
All right, we're going to run to a break. I want to talk specifically about some of the elements in the transportation bill and Medicaid, which is very popular. I polled on that. Both programs, both the traditional Medicaid and the governor's program, are popular. And I think voters, by the way, have now rated that as a higher priority than I would have thought. You know, just sort of talking generically about it. All right, I'm speaking with State Senator Rob Teplitz. We'll be back.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Business Council Education Foundation, educating citizens and business leaders about important public policy issues and civic affairs. This broadcast of Pennsylvania Newsmakers is brought to you by BetterSaferRoads.com. To voice your support for safer highways and less traffic congestion, visit BetterSaferRoads.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back with State Senator Rob Teplitz. We're talking about the legislative agenda now. Transportation, now we got this issue of prevailing wage. That would be whether you go up to $100,000 and you don't have to pay the prevailing wage. That's a wage structure built into law for when you do public construction projects. If the House passes that reform bill, is the Senate, they're calling it reform, is it something you think the Senate would buy into?
No, I don't think that's what the Senate would pass. I think the Senate would likely strip it out and send a bill back to the House, a clean version, and then the House would be back in the same position that they're in now. Attaching these controversial issues like changing prevailing wage, like liquor privatization, which was the hang-up in the spring, that's not going to get transportation done. Let's debate those other issues on their merits, let them rise or fall on their own merits. But transportation is too important to get caught up in those things any longer.
All right, now the transportation bill, wholesale gasoline tax, I think it's obvious that it would be a rise, the first rise in 25 or 30 years when it was set at a relatively low figure. There's some concern that critics and opponents would go after you folks and say it's the biggest gas tax hike in history. You have the problem of a surcharge that you put on in the Senate to, if you get picked up for speeding, I don't want to get picked up for speeding, you pay this. But can you do a transportation bill without a gasoline tax hike? I mean, how do you get the money?
Well, and just to clarify, the gas tax actually goes down in Senate Bill 1. It's the franchise fee that the oil companies paid.
Right, the gasoline, I misstated.
It has an artificial cap now. We would allow it to fluctuate with the market. But at the end of the day, it's been estimated that under Senate Bill 1, which I co-sponsored, the bipartisan bill that passed in June, it would cost the average driver $2.50 per week. I would argue that that's money that you're spending now because of maintenance on your car, because of bad roads and bridges and things that happen to your car, because of now extra gas through detours since PennDOT had to restrict bridges across the state. And so, you're already paying that or close to that now. It's a modest investment in order to ensure the public safety and to create jobs and have a great stimulative effect on our state's economy.
Right. So that seems to be, would you agree, the biggest hurdle, is getting lawmakers who've taken no tax hike, no fee hike pledges, particularly in the House, to get over that hurdle. I don't know about the registration motor vehicle, registration license fees haven't been raised in 10 years, maybe not as big a problem.
And the time period's extended on those,
to 2 years.
So there's an advantage.
Yeah. So all things being even, would you say that lifting the wholesale gasoline tax, that's the biggest hang-up, and the prevailing wage?
I think so. I mean, I think for some, they don't want to vote for anything that could come back to haunt them in an election. A tax, a fee, whatever it is you want to call it. It's a tremendous investment in this area, central Pennsylvania, $1 billion worth of investment. So I think it's worthwhile, and I'm happy to defend it.
Poll after poll has shown public support for it, and polls have shown that, I've done them just to be candid so everybody knows that, that the voters of the state are willing to pay between $2.50 and $3.50 a week in additional gas tax. Now, I'm not advocating, I'm merely have to be neutral here, but it seems to me that's, from all that I've read, and the polls that I've done and read others have done, that's pretty supportive, right?
Exactly.
All right, we got about 2 minutes. Medicaid expansion, it's a big deal. What happens if HHS Health says no to the governor's plan because of its nature? You know, you get a subsidy, then these folks go into the private marketplace. We see how that's not working so well. Do you think that leads you back to regular Medicaid expansion?
I think so. I think we would be back at the bill that the Senate passed with an overwhelming bipartisan vote in June. And what we need to focus on is this saves the state hundreds of millions of dollars each year. It insures 500,000 Pennsylvanians. It creates 20 to 30,000 new jobs across the state. I mean, it's a win-win for everyone, and it's the morally right thing to do.
Here's, I mean, just to go down to what the critics say, that the federal government pays a certain amount now, and you know they're going to pay 90% of it, and then it's going to drop. And there's this concern down the line that if the feds cut the state, the subsidy in a sense to the state, that long term this could be a huge problem for the state financially.
I understand that. I mean, it starts at 100% and it goes down to 90%. I understand that, but the state can opt out at any time. So the sooner we get in and start seeing how it works, get our 3 years of the feds picking up the tab for 100%, then we can judge if the feds don't keep their commitment as it goes lower. But we should get started. It's too important of an issue to get caught up in some of the politics like it has been this year.
All right. Well, look, I want to thank you for coming on. You'll come back and give us an update, I hope, when we move through the final waning weeks of this year's legislative session. I think I got that right because you got a whole other year in the same session. All right. In the wake of the Jerry Sandusky sexual abuse case, there's been a lot of action on child protection laws. We're going to get into some of the specifics of that in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, well, in the wake of the Jerry Sandusky sexual abuse case, there's been renewed concern and interest, rightfully so, in child protection. If the host can make that observation, I just did. Joining me to talk about that is Kathleen Palm. She's the co-founder of Protect Our Children Committee. We're going to talk a little bit about this, but before we get into that, I want Kathleen to say something about a child abuse hotline that maybe I'm unaware, of the specifics and details of it, but this is an important consideration for all of our viewers to think about. What's the child abuse hotline? What should people do if they suspect that there's abuse? Go ahead.
Well, we have a state child abuse hotline. The phone number is 1-800-932-0313. And so if someone has a reason to suspect that a child's being abused, they'd call that number. That's the way in which a child would be connected to an investigation, either with children and youth or with law enforcement. And so if you're a mandated reporter, a teacher, a physician, you're obligated to make a report when you suspect child abuse, but any person, a neighbor, a grandparent, can call that line. They receive about 140,000 calls last year. That leads to child abuse investigations, and then it's really it's kind of the lifeline for a child. It's whether or not someone's going to step in, investigate, and potentially stop abuse that a child's experiencing.
Yeah. Now, the hotline itself, I mean, I have to ask this question in the wake of what's going on with the Affordable Care Act and the fact that people are having loads of trouble getting it. Does it work?
It does work. I mean, we've had challenges in the last couple of years with dropped calls. It is important to note that it's one of the places we as a state haven't invested a lot of money throughout the years. We've let technology really kind of fall there. And so some reports literally are still translated from that hotline to a DA, for instance, by regular mail. And so there's an attempt now, I know, hello, this is the 21st century, there's an attempt now.
Oh, you saw my face immediately.
Yes, to translate those reports electronically.
Well, who's responsible for it in the state?
It's done through the State Department of Public Welfare.
The State Department, is that the appropriate department to do that, or should it be?
Well, it has long been, and I think it's the right way to go for now.
Okay.
One of the things we're going to have to watch is that we obviously are moving a lot of legislation through the General Assembly, including putting much more of an emphasis on reporting child abuse. And so if we're already having a problem with technology and we're already struggling a little bit to get those calls answered, we're going to have to make sure that we're really tracking that and paying attention to it.
All right, so let's walk through this. So you get a situation where someone suspects child abuse. They call the hotline that is handled by someone in the Department of Public Welfare, correct?
Right. So
Then what happens to it? Then it would be referred to a district attorney's office in the appropriate county, or am I wrong?
Well, it depends. If it's a case that involves what we call a perpetrator in Pennsylvania, which is the parent, essentially a family member or a direct caregiver, then it gets referred to a county children and youth agency. And there are 67 of those in Pennsylvania.
Okay.
If it's a crime against a child where it's not necessarily a family member or direct caregiver, so the school employee or the basketball coach, then it goes to law enforcement. We call those law enforcement only cases. We had about 4,000 of those last year. There were about 26,000 calls last year that translated into children and youth investigating whether or not a child was abused by a perpetrator.
All right, we're going to do a quick break. When we come back, I want to talk with you about some of the changes that are being proposed in legislation that affect some of these important things, such as improving reporting, mandated reporting. Some of this is very important, and I think it's been, quite frankly, underreported. We'll get into that subject in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hey, welcome back. I'm talking with Kathleen Palm. She's the co-founder of Protect Our Children Committee. We're looking into various aspects of child abuse and how to make sure that reporting is done properly so that suspected cases can be handled properly. And a couple of the changes that are in legislation would be to improve the reporting. Give me a quick overview of that.
Well, I think a couple big issues is, one is, you're posting the number for a child line, it's a little complicated, so if we could get to something that's a little easier for people to remember is one conversation. Probably the thing that's most significant that people will understand if you look at the Penn State Jerry Sandusky case is that we currently allow what we call the chain of command. So if I'm responsible to make a report, I can tell my boss, and then my boss then potentially makes the report. And so we'd remove that. We would say to that mandated reporter, you pick up the phone, you call Childline, you call an outside authority.
You don't go to your superior if you suspect
you eventually tell your supervisor or superior so they know, but you first make a call to the people who are trained to investigate.
Did that recommendation come out specifically of this one assistant coach who told Coach Paterno and whether he, get into all the specifics of that. Is that what produced this?
I think that was the final straw. We had seen through years, particularly in some institutions, whether it was the Archdiocese of Philadelphia or schools, where people did their legal mandate. They would tell someone within their institution, but then the institution may not have reported it outside of the institution.
All right, how about mandated reporting? In current law, there are certain people who must report it, and the proposed legislation would expand who has to do this reporting. Do I got that right?
There's some degree of expansion. I think it's possibly also that there's just this level of clarification. We emphasize the importance of, if you work directly with children, if you are in a regular basis engaged with children, including people in a volunteer capacity, you will also be a mandated reporter. And so it's not as ambiguous, hopefully, going forward. There are also things around mandatory reporting will be that the penalties for failure to report will be increased. That's pretty important because, again, most people do the right thing and make the call, but there are some folks who know and have information but don't make the call. And I think the other thing that I'd emphasize is just that some people worry about making a call because they think, I don't want to remove a child from their home. What if it's traumatic? The most important thing about making the call to Childline is that oftentimes a child gets help even if there's not abuse there, but there's some stressor. Right, there's some stressor going on in the family. So people need to look at it as both a lifeline and a safety net for a child and make the call.
Yeah, one of the things that has come up in one of the proposed pieces of legislation has to do with the definition. What is sexual abuse?
Well, our definition of sexual abuse is not nearly as out of sync with the rest of the country as our definition around neglect and physical abuse. And so fundamentally, the definition drives everything. Because again, back to that hotline, when someone calls and says, I want to report this, that screener at the hotline is listening to say, does this meet the letter of the law with regards to how we define it? And so if we don't really pay attention and fix our definition, which quite frankly has needed fixing for decades, we're not going to really be a protective state or a child-centered state. And so we're hoping, we literally have cases where it's not just our definition, but who can be a perpetrator. We have a very narrow definition of who can be a perpetrator, that parent, the paramour of a parent. There are lots of scholars who look at the Sandusky case and aren't convinced that under our current law, a Jerry Sandusky would have been a perpetrator under the Child Protective Services law. So there's a real need to tighten that up and clarify that because, and to fix some problems we've had within our school systems in terms of treating abuse there differently than what we treated in any other setting.
And we have about 30 seconds left. Sharing information, how that all gets shared?
Huge. We have had 403 kids die in the state or nearly die in the state over a 5-year period from child abuse. 85% of them are 3 or younger. Their safety net as a physician, if we're not talking to docs and docs aren't getting information, those kids are less safe.
All right, before we go, I want to. We often criticize the politicians. The House had a task force, produced a 427-page report, 11 public hearings, did a lot of good in that. We'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.